Hello, my name is Rochelle Reimer. I'm an assistant professor at Des Moines University, and I feel a little out of place because I do not claim whatsoever to be an expert on Latinos or Latino culture. I just sort of fell into this research interest, and I think that hopefully that you can learn a little bit about what my research is, and that maybe I could get some good feedback from you all about how to maybe interpret some of my findings, because like I said, that's not necessarily my area of expertise. I do research on disparities, and the topic that I'm going to talk about today is disparities between white non-Hispanic women and Hispanic women with respect to HPV vaccination. And this is particularly important because HPV is the most common sexually transmitted infection in the United States. I probably am sort of preaching to the choir, but and the Latinas are more likely to contract HPV-associated cervical cancer than white women are. And the numbers sort of speak for themselves, but this is in terms of incidence and mortality associated with HPV. So I started looking into this and found that most of the justifications or most of the explanations were about lower rates of Pap screening, and that they eventually present, that Latinas are more likely to present at an advanced stage of cervical cancer, which is why they're more likely to then die from the HPV-associated cervical cancer. There is a fair amount of research on HPV, sort of what are those things that affect whether or not a woman gets the vaccine. And what we know is that, if you have an increased perceived risk to HPV, you're more likely to be vaccinated. If you think you're more susceptible to getting HPV, you're more likely to be vaccinated. If you think that the vaccine is effective, you're more likely to be vaccinated. And if you have fewer barriers, if you perceive that you have fewer barriers in your life to get vaccinated, then you're more likely to then become vaccinated. The problem with this is that there's only one study out there right now that included Latinas that was published looking at predictors of actual vaccination. And they found that Latina women were less likely to be aware of HPV and less likely to be aware of the availability of the vaccine. They were not, however, less likely to actually have been vaccinated. The reason is the study was done pretty shortly after the vaccine was released to the public and right after the public health campaigns were out there, so there wasn't a significant difference there. The problems that I'm trying to identify with the research that I'm going to present today is that most of the research has been done using one particular theory. That particular theory doesn't really address some of the sociocultural differences that might exist and how those differences might be important for health protective behaviors. And most of the research has been done on white college students, has been done just on immigrants and not necessarily on Latinas who have lived here for multiple generations. And that hasn't all been high quality research. Some of it's just sort of been qualitative studies or focus group studies. And so we don't really have a very good idea of what are the numbers and what do they look like and what are the things that are really affecting whether or not white women and Latino women get the HPV vaccine. And so that's what my study is designed to address. So I conducted this study in Des Moines. So like I said, I work at Des Moines University, and I got to Des Moines University, and I was able to build some relationships with some of the healthcare clinics in Des Moines that serve both white and Latino women. And so I relied on the primary healthcare clinic, the Mercy Medical System, and then I also recruited a few women from the Children and Families of Iowa Association. I collected data from over 300 women, and it was pretty evenly split, about half white, half Latina. And I included some things that I think are important that have not necessarily been included in previous research. So I included sociodemographics that you would expect in any research study. I looked at age at first intercourse, and this is important because what we see among sort of the general research literature is that people who are at higher risk for HPV tend to be aware of that risk. So they know that they're engaging in riskier behaviors, therefore they're more likely to get the vaccine. But I don't know if that's happening in anything other than white college students. So that's why I included that. This study looks at actual vaccination status. So there is older research that looks at HPV vaccination, but it looks at whether or not you'd be willing to get the vaccine if it were available, because a lot of that research was published before the HPV vaccine was actually FDA approved. And so when you're asking people to report what they would do for a hypothetical vaccination, you can't necessarily make the same conclusions or take it with as much weight as you can when you're looking at actual vaccination status. So we looked at whether or not these women had actually been vaccinated. We looked at HPV knowledge. Like I said, there was just that one study that looked at disparities in knowledge, and so I wanted to look at that a little bit further. We also looked at mother-daughter communication. I did a previous study where I looked at mother-daughter communication among college students at Iowa State University. And what we found was that even just among college students who are above the age of consent, so they don't need their mother's approval to get the vaccine, mother-daughter communication that they had while they were still living at home and while they were a minor was still influencing whether or not they received the vaccine. And so we assessed a couple different aspects. I'll talk about that in a little bit more detail. But mother-daughter communication was very important in our study that we did at Iowa State, so I wanted to take that here and do that with the community sample. Norms and religiosity are two of the important factors that have not been included in the theoretical research that I mentioned before. So religiosity is obviously a very important part of a lot of people's lives, and the only way that it's really been investigated is to look at whether or not parents will let their kids get the HPV vaccine. And most people are accepting of the HPV vaccine, but for those who are not, religiosity seems to be one of the big reasons. And because religiosity seems to be particularly important among the Latina culture, I think it's kind of an obvious error that it hasn't been included in any of the existing research. Norms are also an important part of our health behavior. So if I perceive that other people around me are engaging in this health protective behavior, how and what degree does that influence my behavior? And so I wanted to look at how norms might affect the behavior of my white participants versus my Latina participants, because there could very well be differences there. So this is a slide with a bunch of numbers, and I'll just sort of point out what the important parts are. On the left-hand side, you see the variables that I looked at. The first one is vaccination. And so the first question was, are the white and Latina women differently likely, or are they less or more likely to be vaccinated? And I found no significant difference. So both the white women and the Latina women were equally likely to have received the HPV vaccine when I did this study. So there was no difference there. And like I said, there's been a little bit of inconsistent research on that, so this isn't really against current findings, just another piece of evidence that suggests there's no difference. And this is probably likely due to the fact that I recruited these participants from healthcare clinics. I looked at age at first intercourse. The Latina women had intercourse, their first intercourse, at a significantly later age than my white participants. So on average, the white women started having intercourse at age 15, and my Latina participants started having it around 17. The Latina women had significantly lower scores on the knowledge question, so they had less HPV knowledge or less accurate HPV knowledge than the white women who participated in the study. And then there's two different communication variables. We split it out to look. So did you communicate with your mom about sex? And did you communicate with your mom about sex with respect to values? So the first communication about sex variable looks at, so did you talk about puberty, development, sexually transmitted infections, when to start having sex, those sorts of questions. The communication about values item is specific to, did you talk about sex in relation to cultural, religious, or moral values? And so what we see is there's no difference between the two groups with respect to communication about sex. So I was actually kind of surprised by that. Both groups of women reported that they were equally as likely to talk with their mothers about issues of sex and sexual development. The Latina women, however, were significantly more likely to say that they talked with their mothers about sex in relation to values and cultural, moral, and religious values. So that pattern is there.